All right, thanks, Sam. And you're absolutely right. Kenya will be joining the world in marking World AIDS Day right here in Meru County. And we are live from the Alba Hotel in Meru, where Kenyans are already streaming in to different venues to mark the World AIDS Day. Now, there's some statistics that we'll talk about in just a bit, but before that, let me introduce my panelists real quick. Dr. Ruth Loiboni Masha is here. She's the CEO, National Endemic Diseases Control Council. Thank you for making time. Medin Sehayu is also here, UN AIDS Country Director. Thank you for making time. And Brian Redman, Pepfar Country Coordinator. Thank you very much for making time. And Medin, I'll start with you here. The theme this year is Let Communities Lead. Why did you choose that theme, and what does it mean? What's the bigger context of it all?
Thank you, Trevor. Communities have been leading since the early days of the pandemic, and the progress that we celebrate today is because of the great contribution that they have made. That's one. Then number two, communities know what strategies work for them. They are able to connect people to facilities. They know how to address the stigma, discrimination that hold back people from accessing services, and they are innovators. So because of that, member states of the United Nations in June 2021 committed to support communities to lead in the AIDS response. And in fact, because of that, in the UNAIDS governing board, communities are represented because it's nothing for us without us. So that's why we say let communities lead, but they need to be empowered, recognized, and also resourced so that they are able to partner with government and with other stakeholders to make sure that we end AIDS, especially in Kenya, the ambitious target of ending AIDS by 2027. So it's very important that communities are at the forefront, leading, being in the governance, being part of the planning, implementation, and even providing feedback so that they can monitor and feedback whether the services are working for the people, whether services are people-centered. That's why we say let communities lead. Okay,
let me bring in Brian on this. And Brian, Medina has mentioned something interesting, that for the communities to lead, they need to be empowered and resourced. You just marked Pepfar 20. What would you say are the greatest achievements in 2 decades?
Great, thank you, Trevor. The President's Emergency Plan for AIDS Relief was announced by George Bush in 2003. And at the time, Kenya had about 5,000 people on treatment or so. And since then, we've now placed 1.3 million people on life-saving treatment. And that's more than just numbers. Earlier this week, we opened up the gallery that we have at the library, demonstrating 20 wonderful stories of heroes who are interacting with the activities that we do. And I invite anyone to go out to the library to see those stories. They'll be up for the next month or so. But they really are just representative of the millions of people that have been affected and really have had their lives changed through the partnership that we have between Pepfar, the government, and Global Fund. Those activities are, keep people on treatment, but it also prevents people from getting the disease and making sure that those communities actually can thrive.
All right. And Masha, we still have more than 248 infections weekly. That's about 35 per day. What progress have we made in the fight against HIV and AIDS, and what are the gaps that you see?
Thank you very much. Trevor, just like we said, we made progress, and what we want to do now is to translate progress into success. And success will look like this, that we don't have any child being born from a mother who is HIV positive and then they get the infection. Success will look like when we can be able to say we didn't have 18,000 too many deaths in 1 year related to AIDS illnesses because we have access to treatment. And finally, success will look like when we know everyone who is HIV positive can walk into any facility without fearing anyone is going to see them, and they have confronted both self-stigma and community stigma, and they can access services. So success will look like that, and that is why we are saying those are the gaps that we are looking forward to filling, and that's why we think that the job that is remaining can be done, especially if we let communities lead the way and they show us where to go next.
All right. And Medina, you mentioned issues of empowerment. How would that look like? Because we know now that about 8,538 women are part of the people who died out of the AIDS-related deaths in 2022. How then can communities be so empowered well enough to speak about this boldly and even stop the stigma in a situation where sometimes the cultural setup disadvantages most vulnerable groups?
Thank you, Trevor. As I said earlier, communities are part of the people who need to access services. So that's why they know what are really the issues that is holding back people from accessing services, whether the stigma, discrimination, maybe economical, cultural, and all of that. So when communities are organized, they know what is going to work for them. But again, the empowerment should be related to the enabling environment that they can operate in, so that they can address some of the challenges, the structural barriers that are causing, for example, the triple threat that we are talking about, the teenage pregnancy, the sexual gender-based violence, and of course other result, the number of new infections that you talked about. So the empowerment is that they need resources, right? Yeah. Unless we are resourcing them, they will not be able to operate to the maximum because they have capacity that we have not really harnessed enough. And they need to be also looked at as equal partners, right? I mentioned earlier that they are in our governance board in UNAIDS, and I'm hoping that moving forward, especially with the launch of the UHC, communities are part and parcel so that they can feedback what is working, what is not working, and will be able to move towards the last mile. So empowerment can be expressed in different ways. Creating the enabling environment, resourcing them, recognizing the great work that they are doing, and enable them to really reach out to those unreached for a number of reasons.
Who do you think should champion this? Is it the government? Is it NGOs? Is it the people themselves?
I think it's a partnership, basically. That's what I'm trying to refer. So government has a role to play. And development partners, the same thing, private sector, because HIV is not really an agenda for one, whether government or another, but we need to join hands, right? So what is the division of labor that we need to have? What responsibility? At the end of the day, it's a mutual accountability within partnership, right? So government has a role to create that enabling environment, making sure that, resources are also flowing to communities because they can really deliver in an excellent way, in a more effective way, because they know, who has really access services, who has got a challenge, and what the solution is, right? Because I refer to the innovation as well. For example, during COVID period, people were not able to go to facilities to get their medication, right? But with the community ART program, they were able to deliver so that people are able to adhere to their treatment services and achieve viral suppression. So there is a number of things that they can do, but again, not just government or others, all of us have got a role to play. And of course, community themselves also need to be accountable.
Okay. And Brian, what would be the picture of success going forward? You mentioned more than 1.3 million people on medication. What is the target going forward?
So the target is to get that up to the full 1.4-ish million that are living with the virus, and taking those new infections down to zero. In doing so, we can really control the epidemic, and then the next step is to understand, okay, how do we ensure that we maintain that moving forward, so that as we look at the next 20 years, how do we ensure that those individuals are continuing to live and thrive, really? Okay.
Marsha, picture of success for you going forward?
I think for me is when we see that young people are empowered and are able to protect themselves from HIV. And also when we can see that we as stakeholders, we are actually not having any child again born with HIV. And that's very, very important, because as a country, we know that we have a very young population. 59% of our population is below the age of 24. And what that means is that if this is the same group that is getting the new HIV infections, it will take us a long time for us to end this epidemic, especially if the older people, of course, on treatment, who got HIV in the early years, are stable enough, they are living a good quality life, and then also we have children and adolescents getting HIV. That means we can't break that cycle. So success is the ability to end those infections from children and adolescents and young people.
All right, let's take a quick break here on Citizen TV tonight. We'll be back with more on this conversation before the world marks World AIDS Day, which is tomorrow. We'll also have questions from the audience, and we'd like to hear from you as well at Trevor Mbija, at Sam Gituku. Use the hashtag tonight. See you in just a bit, and here's what's coming up.